Okay, we have begun. Thank you, everybody, for attending. And I think we're gonna do some introductions. I think it's gonna be about a minute before everyone's in here. And this is something that and I know some of you might know this already, but we're doing this event just a little bit differently. And I'm Jose Garcia. I'm one of your hosts for this event, and my fellow host is Ekanjali Dhillon. Thank you so much.
Hello, good afternoon. Welcome to everyone, and nice to see you all. My name's Ekanjali. Some of you may know me. I'm a physician by background and now work in digital transformation here in London. So yeah, back to you, Jose.
Well, and to illustrate storytelling techniques and conventions, we're framing this event with a meta narrative. Kanjali is Princess Leia, the CEO. I am R2D2. That's a little robot, by the way. Kanjali's not seen Star Wars. I'm a helpful little robot. Beep, boop. I'm the CTO. We have a health AI startup, and we have a wonderful new technology, and we're very passionate about it. But we're having difficulty communicating with people. We're very good at talking to each other. When we talk, so me and Ekanjali, we speak, it's almost like we speak our own language, but when we actually go to other people, they're a little bit, oh, okay. They feel a bit bombarded. They don't understand the context of the conversation. So we have ventured out, and actually we're in kind of a weird place right now. We're at the beginning of a journey, and we're not happy with where we're at, but we don't know what to do about it. So here we meet Obi-Wan Kenobi. And Obi-Wan Kenobi is going to train us. And I'm going to there. And her name really isn't Obi-Wan Kenobi. Kate Markland, thank you so much for coming and to speaking to us. And before we begin, wondering if you could introduce yourself.
So I'm Kate Markland, not Obi-Wan Kenobi. My background is as a physiotherapist and multiple award-winning clinic owner. I now also mentor other clinics in how to run a healthy business.
Thank you. And I was actually watching a launch for a very exciting new health AI company. And I was speaking to a lot of startup founders. And when you're listening to them, sometimes you feel a bit bombarded. They are talking about their technology with an incredible passion. They are talking about the features, and it's quite rapid fire. It's a bit intense. And I've also heard this from on the other side. I was having a conversation with a hospital CIO, and he was saying that often when he hears from new technology vendors, especially in the health AI space, he doesn't understand the context of where he fits in, what they want, where's this conversation going? And I'm wondering, this is kind of like a fundamental problem that a lot of startups founders have. They're making the shift from talking amongst each other to other people. Mm. They have to change their language when they do that. And I'm wondering if you can give some advice.
Yes, of course. So the analogy I like is that the developer, the tech engineer, you've had your head down on the Monopoly board. I don't understand all the gizmos and widgets and whatever you move around, but you've had your head down here. Now it's time to look up and speak to the other person on the other side of the Monopoly board. And they are not a Monopoly piece. They are your mum. They are your granny. They are your son. and they want you to connect with them in a language that they can understand and receive. See, people don't buy into medicine. They don't buy into physiotherapy. They're buying into an idea. They're buying into a trust and a confidence that what you offer is going to create a brighter future for them. And it's that feeling, that belief that your solution is going to make their lives easier, less painful, less difficult, more meaningful, that's important to them. And that's what's going to bind everything together in your business. Because the dark force you're going to be battling with is that you want your tech to be the hero of the story. And it's not. It never, ever is. We're going to flip to Cinderella for a moment. Can you imagine if that fairy godmother's wand was suddenly the main protagonist in the story? It would have just become another ugly sister. It would have just become another villain, competing with Cinder's for attention. Now that wand has got to work. It's got to deliver on time. You've got the interval of about 10-15 minutes for that wand to create a beautiful dress, conjure up a carriage and some footmen and everything else. So it's got to work. It's got to deliver. But it's a prop. And it will get the product placement that you want your tech to have if it does its job well. Everybody knows the fairy godmother's wand. Everybody knows the car in Back to the Future. Everybody knows when the tech has worked well, but it's never the hero of the story. And so the patient that you're wishing to help, I would like you to imagine is your mother. Because nobody wakes up in the morning or in a hospital bed, at home, in a care home, wishing they had another tech solution or another AI solution in their life. They wake up wishing somebody would just help them wash their hair because that will make them feel $1 million. Somebody will just bring them a piece of fresh fruit or some homemade tomato soup rather than the junk they're getting here. Somebody will hold their hand, massage their feet because it's weeks since they saw their toes. They want to know that somebody will help them get into a chair again so they might see blue sky again. They might get outside and smell sea air once more. They didn't consent. They didn't consent to neglect by your tech. And that's a really important point. People have to consent to every single intervention that they receive in healthcare. But do they consent to neglect? And do they consent to neglect by computer? And I very, very much doubt your mother did that. And if she's not able to consent for herself, I doubt you consented to that for her.
Oh, it's very powerful. So it's that framing is really, really important. And it's really difficult, I think, for a lot of founders, their heart's in the right place, but they're so emotionally invested in all the things, and a lot of them are working 100 hours a week, and they have been for quite a while, sometimes years, to get to this point.
Yeah.
And to let go of that, or to change that mindset, and because they're struggling with it for themselves, and I'm wondering, how do you? I think another thing they have, another frame shift is a lot of people, when they are beginning this journey, they're so focused on that initial yes and trying to get an initial yes from a gatekeeper, and that they kind of forget that this is going to be a 5-year relationship for the other person. This is a very long process. For the other person, it isn't the initial meeting or the initial consideration. They're thinking, okay, if we say yes, this is at least 3 years between pilot, to full adoption. And how do people have to think when they're telling a story, when they are trying to get people to think not about that initial meeting, but a longer term relationship? How do they approach that?
The Jedi mind trick that you're looking for is the shift in narrative. You've got to be speaking the client's language. You've got to be speaking in their terms. You've got to do the translation. You can't be speaking to them in French and expect them to understand if they're Australian. You've got to find out what their language is, and you do that by listening. And you listen with curiosity, asking open questions. Tell me more, tell me more, tell me more. So you're really unpicking the problems they're facing. Because yet more data collection probably isn't the answer. All you're going to be measuring is deterioration and decline in the data according to that. They're going to be looking for other solutions. But the only way you're going to find out how you align to their problem is by listening to them and asking questions and questions and more questions. And you'll quite possibly find that the question that they are looking for an answer to is so basic that it would have never, ever entered your head. So you can't sit behind your screen or in a meeting trying to theorize it because you're not going to find it. You're going to find it by talking to your clients and really, really listening. So you're not trying to sell, you're trying to understand the problems that they're facing and the philosophical questions that they're asking. And then you can present your solution in terms of not the features and not the benefits, but the emotional benefits that are going to create the transformation that you in your heart would desire that your software makes.
I see you nodding there, Ekanjali. Ekanjali is on the other side of a lot of those conversations, aren't you?
I am, but I mean, Kate, your clinical expertise shines through because it sounds like what you're saying is the hero of the story is often listening, and the tech is the product placement. Love that. I just wondered if you could expand perhaps on a time where understanding the narrative of the client, of the patient, has helped perhaps translate some of what you're trying to do. Is there a particular instance you can think of around that, or an example, perhaps a story that would help embed what you're saying?
Well, that's a very, very simple one. My mother was that lady in bed A1 who was being neglected by data collection. And I asked a very, very simple question to the consultant. I spoke to the ward sister. She was livid with what was going on her ward as well. Invited me in for the ward round in the morning, and I asked the very same question: did my mother consent to treatment by neglect?
All right.
He was out of that bay in a flash, and there were more physios and OTs in that bay than they'd seen in a month. So, but the sister was speaking the same language as me. She just wasn't being able to get heard.
Right. Interesting.
Okay.
And the other part of that is the desire to measure and measure and measure everything. That lady in bed A1 might not have had her bowels moved for 2 weeks. She doesn't need another CT scan to show that. She knows that. You've got to be listening to the person and the common sense that they're communicating, and then you can offer meaningful help. Otherwise, you're just monitoring their decline, which isn't why you've created your piece of tech. You've created your piece of tech to make meaningful transformation. And for it to be able to make meaningful transformation, you've got to ensure it creates the emotional connection with the end user.
Thank you, Kate. That was really helpful.
Okay, now we're venturing out. And this is the part of the story where you leave. So at the beginning of the first quarter of the story is usually an internal conversation about who you are and why you're doing things. The second quarter, you venture out and you start going on an adventure. Things start getting more complicated. This is where we meet Lando Calrissian, marketing. Hello, Lando. Thank you for
Hello. Hi, everyone.
You may recognize Kofi from my LinkedIn feed, and I've been using a lot of your insights in my conversations with people. And before I do, actually, I want to go straight into the question, but I wonder if you can introduce yourself before we do that.
Sure, definitely. Yes, my name is Kofi Anan. My company is called The Brand Sensei, and my experience in the healthcare industry dates all the way back for probably about 20 years, but I've primarily work with a lot of companies, tech startups, some brands like Bayer and Pfizer, and then also organizations like the National Sleep Foundation, particularly helping them focus on how they're able to build a brand, talk about their solution to people outside of their organization. And as we know, particularly within the healthcare context, there is that patient on the other end. So it's even as very important to contextualize that and bring your brand and your solution to the world in a way that it is engaging and people understand it and they're able to use it to the betterment of health. So I help map that all out.
Thank you. There's something you said. I think I put a clip of you saying this, and I've been using it in my conversations. Technology is disappearing or declining as a differentiator. And what is rising in its place is your understanding of the problem that you were solving and your ability to communicate, or you said lean into your humanity, express that, and engage with people online. I say that to people, and they go, wow, can you tell me more? And then at that point, well, maybe you should talk to him. I'm wondering if you could speak to that now.
Yes, definitely. Yeah, it's something that I realize is even more important in health. But then as we layer on technology, it becomes even crucial. A lot of the people within the health tech community, health and tech community, are experts. So they know the biology, they know the science, they know the technology. And a lot of times, while it's in service of the patient, sometimes that gets lost. And a lot of times we feel like the value the brand is bringing is in the solution. So we're very passionate about what we're doing, and we want to talk about that. But as we've realized, especially in the past 3 years, with the advent of AI changing literally every single day, a lot of that as a differentiator has become a commodity. There are more than enough AI solutions in health right now. Even if they're not being adapted, they're being evolved. So that's not really going to really seal the deal as it relates to who's using your solution and who's buying it and which patients get to see it. So you do have to kind of go back to, okay, what is the motivation of the people that are behind that solution? Why are you? Why are you the person to bring that technology solution to market? What makes you as an individual and your team special? And so leading into that story about who is behind that solution. But then on the other side as well, you have to lean into the humanity of the people that you're serving, the people that you're talking to, that you're hoping to buy. If you're selling a technology solution, that they're hoping for them to acquire that solution. What do they care about? What are they worried about? Again, that's all the human end. And then obviously on the other end is the patients. What do they care about? What is their lifestyle like? What are they trying to solve for? Those are actually the things and the variables that make the most sense and make the differentiator in any health solution. The technology and the medicine is kind of secondary to that. It is in service of that human experience, and we need to recognize and readjust that.
Thank you. I'm wondering if there's a lot of people now who I think they're using outdated marketing techniques.
Mhm.
I know from my point of view, it's like, because I'm in the webinar space, it's you're trying to engage with people with webinars, but you're using this playbook from 2016. And a lot of tech founders are very tech savvy, but they've been in the trenches building their product for years. And it's like they've come out of a time capsule and, oh, this is the way you promoted yourself online the last time we were on social media. We haven't been on social media for the past 3 years. We've been so busy building our product. And it's almost like they're the Japanese soldier doesn't realize the war is over. No, things are different now. You may have been heavily online 4 years ago. It's a different landscape now. What advice would you have to those kinds of people? And one of the problems is they don't realize how much things have changed in, like, say, in the past 4 or 5 years, and now they're trying to engage with people online, and they're venturing out.
Yeah, I find that, outside of kind of the experts and the people who spend a lot of time kind of figuring out, like some of us on this call, yeah, there are two camps of people. There are people, as you explained, Jose, who are um, kind of reticent and kind of, especially in the healthcare context, with regulation and exactly the with regulatory and kind of data quality and trust issues. Some organizations and some individuals are, again, they want to always do what always works, what has worked in the past. We know that doesn't work, and they kind of stuck there. Then you have some overcorrection a lot of times where people say, well, I have to do all the things. I have to be on all the TikToks, all the Snapchats, all the, all the websites and all of those things. And then people get overwhelmed. So I think that what I've seen work with a lot of the companies that I work with, again, going back to that human element. Okay, what are you trying to do? Who are the people that you're trying to communicate with? And what are their behaviors and habits, and where do they live? If you start there, the technology comes out of that, right? So in the case of, so I was working with some years ago with Bayer with a product that was coming out. It was a medical device product that was coming out, and part of that was, okay, how do we engage the sales team so that they can understand the product, understand who they're talking to, and so on and so forth. As we're kind of thinking, and they wanted to go on Facebook and just kind of do all the flashy things. But really, what ended up working, when we did our research, when we looked at the salespeople and we looked at their customers, what really worked was looking at something as simple as forums, right? Something like Reddit, which I know is kind of a bad word in healthcare because it's uncharted territory, too much talking there. But from a, I know, from a insight perspective, because you really need to understand the people that you're talking to, looking at those conversations, deriving insights from there, and then matching, okay, say, what are the channels that they're using to make those decisions? And sometimes that might be internal chat rooms or platforms, and that might be even closed communities. If you're talking about patients, for instance, closed Facebook communities that you have to build relationships with. So you don't have to be in all the places. You just have to be in all the right places where your stakeholders and the people that you want to engage with work. And once you start there, you could then it starts defining exactly what these places are. So that's what I always advise to all the people that I work with. Start with who you're trying to talk to and where they are, and meet them where they are online.
True words. You know what? I want to thank you. You've been a big help to me.
If I may add, I love that framework or strategy that you've provided, the what, who, why, and where, and that to sort of strategize early in terms of how you can build those relationships and develop that trust. Thank you for laying that out so simply and effectively.
Thank you.
Okay. And we're saying goodbye to Lando. And after you've been hanging out, we've been hanging with Lando, things are really complicated. We're venturing out. And this is one of the story where it's good to have somebody who's going to make things maybe simpler, bring us down to earth. Chewbacca, communication and messaging. And we're bringing up we're now on the Millennium Falcon. Welcome, Chewbacca. His name's not
I
Chewbacca.
tried to grow a beard, but it didn't work, Jose.
You can't get hairy enough to be Chewbacca.
No.
We're imagining, it's metaphorical. Welcome, Brian Berkenstock. And he's, you may recognize him. I've posted some clips from previous conversations. And what I really liked about your content on LinkedIn is that simplicity. And you know what? It reminds me of something. Creativity is subtraction. A lot of people think that to be creative, you have to pile on more ingredients, add more ingredients, just pile things up, and that's more creative. But actually, I think a lot of times creativity is getting rid of things that aren't working and having to actually refine that down. but I'm getting ahead of myself. Can you introduce yourself, please?
Oh, sure, sure. I'm Brian B, and my background is in communications. I think I've worked in just about every communications field: marketing, PR, executive comms, video script writing, user experience. So if it's communications, I'm good. If you need to change a light bulb, I got to bring somebody else in.
Okay, I've got some questions for you. What do you see specifically with health AI? There's a lot of startups on the scene. And what do you see the biggest mistakes? Because I know you see the posts on LinkedIn. What do you see the biggest mistakes they're making when they're crafting their product's story? This is a two-part question. And second part is, how should they fix it?
Well, I think Kate Kenobi touched on this already, and that's that most of these health tech companies out there make themselves or their tech the hero of the story. And really the smarter ones, the smarter health tech companies always know to make the customer the hero. And the customer is either the patient or the doctor, whoever the buyer is, basically is the customer. And I just try to remind folks always and forever, with no exception, make the customer the hero of the story, not the technology and not the company itself. And there's an easy way to sort of hear the difference in tone between these two things. So if I imagine I'm at my kid's science fair night and I'm talking to my friend Lauren, and she's bragging about her daughter Maddie, who did all this work for her science fair project. She did the research, she created the trifold, she came up with an experiment, and she gave something interactive to sort of attract and draw the people in. And that's making Maddie the hero of the story. But here I come along and say, oh, last night, my daughter, we were up so late. I had to come in and save the day. I had to help her do the trifold. I had to come up with the idea for what to do for the experiment. I had to write the paper on the side. And you can see how sort of distasteful and icky it is when I'm making myself the hero of the story, when it really is supposed to be, I'm really supposed to be bragging about and congratulating my daughter. And this was a lesson that I learned a long time ago. I used to write for magazines and newsletters that hospitals would distribute. And at the time I was writing, the big hot technology, the AI of its day, was something called open MRI. MRI, everyone's familiar with. It's the tube you have to go into, very claustrophobic. It's whirring and whizzing and clanking around your head. It's scary for people who even aren't claustrophobic. And so they came up with this concept of open MRI, where you're not enclosed in there. It's just maybe 1/4 of the wall there. And so I was writing about the sensors and the technology and how it was just as good as the enclosed MRI. It's really not. But that's what we had to do at the time. But then I had smarter editors than I, thankfully, hit me on the head and say, Brian, it's not about the sensors. And that became like my mantra over the years, even when I was working with other writers, when I was the editor and they were writing, and we'd have to say, you need to go out and talk to some people here. You need to focus on what the customer is, because the story here is about the reassurance that they're getting from the technology, that you're getting the same value, but you're not getting that awful experience from it. So always and forever, with no exception, make the customer the hero of the story.
And I do notice sometimes myself when I'm talking to a founder and they're the hero and the technology is Obi-Wan, I kind of feel like, oh, am I the bad guy in this story? If I say no, I kind of feel that psychologically. It's like I'm almost like I'm being confronted because there's all the other story roles are already taken. And I'm like, I almost feel like I'm the bad guy. But
that's all that's left. Yeah.
I wonder if you could give some advice for technical founders and who are focusing a lot on the technology, and they're making the frame shift to focusing on the patient, but they're not able to resonate emotionally with people. They're having difficulty with that. I wonder if you can give them some tips and tricks for the trade for helping them resonate emotionally with that other person they're communicating to.
Yeah, my guess would be that they're still focusing too much on the technology and not enough on the humanity, really still focusing on the customer there. I recall when I was a kid, every single car commercial, maybe you remember this, spoke about rack and pinion steering. There was never a car commercial that didn't mention rack and pinion steering. I still don't know what it is, but I don't really care what it is. But if someone said to me, it means that your steering is so responsive that you can move quickly enough to save your kids in the back seat from an accident, that resonates with me. That makes sense. That's something that I can connect with. So always focusing on what the story is always about a person. The story is never about the technology. So just keep digging until you find it. As you said earlier, people are very excited about the technology and it's great stuff. But somewhere way at the beginning, it was developed to solve a problem, and that's where the person is. The person is at the end of the line there. So if you have a problem you're solving, then there's really a person's story there. There's a human story in there, and you can find that and bring that forward and bubble that up to the top. And your technology will still sound wonderful because you're solving this problem that a real person has, and we see ourselves in those stories, and that's what resonates.
I noticed that actually I had a conversation on the weekend with somebody, and she did this herself. She says she's skeptical and worried about AI in healthcare. But then she said, oh, I know somebody who's going in for a test, and it'd be really good to know that there was this extra pair of eyes looking out for her and seeing if there was any, helping the doctors detect that she had cancer. And then when she framed it that way, she opened up. She actually did it herself. She did the frame herself. But we still have one more minute with Chewbacca. Princess Leia.
Thank
In
you.
the movie, she's quite harsh with Chewbacca, actually, but I'm sure you'll be more gracious.
I feel Chewbacca today, actually, to be fair. I think I could have taken that title. I love what you said, Brian, around it, sort of saying to yourself, it's not about the senses. It's not about the senses. Often trying to find the story. What is the value that you're trying to extract from the situation? Right. Can you give us an example of when you found that challenging? When you, as a professional in this space, have found it challenging to uncover or find that story? And if so, tips around that, if a technical founder perhaps is struggling with some of that?
Yes. Something happened to me recently where I was having a conversation like this through a video chat with a coach, and I noticed that he seemed to be looking directly at me, which is very unusual because, as you can see now, we're all looking at different spots normally. If I've got a tall monitor, I'm looking up. If I've got a laptop, I'm looking down. And he seemed to be looking directly at me, and I had to stop because it was very unusual. And I didn't know what was going on there. And he told me that it was something that he had experienced with a therapist that he was seeing, that the therapist wanted to have a more direct contact through Zoom because she was missing that with direct person-to-person communication. So what it is, it turns out that there's this little device. It's plexiglass. It hangs down over your monitor, and then it's got a shelf about part of the way down where you set your webcam. And so it looks like you're looking directly at the other person. So you've got this captivating way that it gets your attention because you're looking at someone through video, which is unusual. And then you get a greater connection by doing it this way. And then I also felt like afterwards is when I went out and checked all the technical specs on it, where I still did my due diligence and saw that this thing got good reviews and that it worked in the way that it was advertised. So that was a case where it did all these things: captivate, connect, and it converted me into a buyer at the end. And that was really, even though that's a technology, it was still about the story. It was still about how I felt connected to this person through the technology, on the screen there.
Right. Well, you're going to have to send me the link because you've sold me as well on that.
I'm not making any. I don't make any referrals.
No, thanks, Brian. That was helpful.
Thank you, Chewbacca. Now, this is the third quarter of the story, and this is part of the story where two things happen. The stakes get raised, and you discover you have new needs. In this case, we have learned from Lando and Chewbacca, but it's not enough. We have new needs now. We need investment, and we have to talk to investors in a different way than we do have on social media. So to help us on this part of the journey, we have a member of the Jedi Council, Investor Relations, and thank you, Brian. Brian Litten.
Nice to see you. Good to be here. Thank you.
And I know a lot of people know who you are, but can you introduce yourself? Because we've got a lot of people from Europe, and some people here obviously don't know who you are. But if you can introduce yourself
I'm
quickly.
happy to do so. Brian Litten, I am a digital health CEO. Over my career, I have built and exited a number of companies in the digital health space, all with the common theme of leveraging technology to provide higher quality care and better access to care, primarily for vulnerable and neglected populations. Currently, I'm working with a number of investors across North America, helping them with deal flow and helping to provide mentorship and leadership to their portfolio companies. So a lot of experience navigating technology in the investor space, and happy to share some of my insights today.
And you have heard a lot of pitches from startups. And I'm wondering if you could start just by giving them some introductory advice on how they should approach investors from I'm getting the impression they shouldn't just do a straight commercial pitch. You want something
No,
a bit more than that.
It's a very different kind of pitch. If you have a great AI innovation, and you're ready to launch your venture, you will find that you often need to get access to capital, but you have to approach the world of investors differently, and you have to develop a very compelling narrative to those investors to engage with them, to get them interested in your offering, and ultimately to bring them along in your journey. So how do you do this? It's important at the outset to understand the investor's perspective. Investors are looking at AI solutions that solve real problems. They're looking for solutions that are scalable, but they also have to have a clear path to a return on investment. Entrepreneurs have to tailor their pitch. Different investors have different risk appetites, and they're looking for different types of investments. So you need to do your research and understand what each individual investor might be looking for. Some may prioritize long-term disruption, while others are looking to may seek to look for early traction and quick exits. So know who you're talking to and tailor your pitch. It's also important not just to talk about the technology. In some of the presentations we had earlier today, we talked about kind of avoiding that and talking about the customer, talking about the patient. Here in the case of investors, it's important to emphasize the business value, not just the technology. Instead of providing, when you're talking to investors, a deep dive on technology, focus instead on how AI and technology enhance efficiency, how they drive revenue, and how they solve a pressing industry challenge. It's also important to go to investors with an established proof of concept to demonstrate that there's early traction, that there's a promising partnership, that you've had success with an MVP, that your AI is more than just theoretical. It's also important to be really practical about AI and not to overhype capabilities. You need to communicate clearly about AI's limitations, dependencies, and the ethical considerations. So when you're talking to investors, you need to focus on the market need and the problem that you're looking to solve. How does your technology solution solve an urgent pain point in the market? And how are you differentiated from others in the market? What makes your solution unique? Is it proprietary data, better algorithms, domain expertise? And then scaling and monetization. Can your technology scale across different use cases? And what's the revenue model? So you're thinking a lot about beyond the technology into the business considerations and what the investors want to hear about. Regulatory and ethical considerations. Discuss how your compliance, bias mitigation, and data privacy issues are all being managed appropriately and effectively within your domain. Think about your team and how you execute. Investors bet on teams. So showcase your AI and business expertise, your track record, and your ability to attract and retain talent. Go-to-market strategy. How will you drive adoption? What partnerships, sales channels, or enterprise adoption models are in place? And use of capital. You need to think about that carefully too. You know you need capital, but be really specific when you're talking to investors about how much capital is needed, how you're going to use that capital, what milestones will be achieved when you deploy the capital, and what are the KPIs you're going to use to measure your progress, and if there's the need to perhaps pivot or adjust what you're doing. And without doubt, there will be occasions when you make a misstep, or maybe you say something to an investor that's not fully accurate, and you realize along the course of the way that you need to make a correction. Own your mistakes. It's not a problem to make mistakes. We're all human. We all make mistakes. If you say something to an investor that is a misstatement, acknowledge it quickly and correct it confidently. Pivot to your strengths. If a particular claim is weak or challenged, validate the strengths of your business. Engage in dialogue. Investors appreciate a thoughtful discussion. So if you don't have an immediate answer, offer to follow up with data. And turn objections into opportunities. A tough question from an investor often signals that that investor has interest in you and what you're doing. Don't be defensive. Show that you're open to constructive feedback and willing to refine your approach. When you're considering your immediate needs for short-term capital, always have your longer-term strategy in mind. So think beyond the first round. Building relationships with investors is just as important as building relationships with your customers. It's an ongoing process. Ensure that there's alignment on vision, on risk tolerance, and value add beyond capital. And think about how you diversify your investor base. There's strategic investors, venture capitalists, private equity, angels, and corporate partners, and they all offer different benefits. So you need to consider which type of investor aligns best with your growth trajectory. And also plan for future rounds early. Fundraising is a continuous, arduous process. Even while executing on your initial round, maintain investor engagement for potential future raises. I like to establish a regular cadence of quarterly meetings with targeted investors to bring them along on the journey of the business. Even if you don't have the immediate need to raise your next round of funds or don't have visibility to raising your next rounds of funds, the relationships that you establish with investors will be really important when those times to raise money do materialize. Think about your exit strategy considerations. Investors, are not putting money indefinitely into your business. So they'll want to know what your thoughts are about the long-term exit, how they'll get their money back, how they'll make a return. Might that be an IPO, acquisition of the business, long-term private growth? But keep those potential end games in mind when choosing investors. Be prepared for AI's evolving landscape. AI regulations, competition, and technology are changing rapidly. So keep investors updated on how you plan to stay on top of this and navigate the shifts. I guess in summary, just remember to approach investors with a clear problem-solution fit, focus on business value, be prepared to discuss critical elements, recover from your missteps gracefully, and build a long-term investor strategy. Thanks.
Thank you, Brian. And we've got 30 seconds. Ekanjali, I know you're not a VC, but healthcare sees itself as an investor, don't they?
Absolutely. And Brian, you touched upon it, which was actually the way that you, the narrative itself, the business narrative that you're presenting, and the variation in the type of investor that you might be pitching it to. Do you have any specific tips on that? Or could you expand on, say, investing to a VC versus a PE fund, which might be a little less interpersonal? So when you're dealing with corporates versus people, and so if you could expand on that.
Yeah, it's a valid point, and I think it goes to the need to understand what the investors are looking for. I don't know, in my experience, that it matters so much that you need to augment your pitch between a VC and a venture capital or a private equity firm, as much as it is doing your research and understanding what the individual investment firm is looking for in investment opportunities. Are they looking for are they only, what size check do they write? Does that correlate to the amount you're looking to raise? If they only write checks for 25 or $30 million and you need $5 million, it's not going to be a good fit. So be aware of that. A lot of investors, whether they're private equity or venture capital, will have thresholds for top line revenue. They won't invest in a company unless it has $3 million of revenue, or at least $10 million of recurring revenue. So know that going into a pitch. Other investors might be looking to see that the business is cash flow positive or has visibility to being profitable. Understand those dynamics too. The most important thing is investing in yourself as an entrepreneur to constantly enhance and hone that pitch. While you're doing your research and you're building a cohort of suitable investors for the stage of the business where it is at that point in time, every time you do a pitch, it should be getting better and better. You should leave that pitch, think about what you said well, what you could have said better, and next time go out of the gate and do it a little bit better. And each time it gets better, it gets sharper, it gets more focused, and you'll have more success.
Thanks, Brian. And it is time to leave the Jedi Council. We are entering the final phase of our story. And we now go, see, final speaker, Luke Skywalker. This is part of the story where we've changed. Princess Leia and RTD2, we've acquired all these skills, but we're untested. And the screenwriters call this phase of the story testing the change. So now we're joined by Luke Skywalker, narrative for healthcare change management. Here we are on the Rebel base on Yavin. Welcome, Amy. Her name's not Luke Skywalker. Can you introduce yourself?
I am so excited to be here. My name is Amy Zolotow. I have lived many lives. I'm currently working in the space of, on the advising side, working for a boutique advisory firm, working with digital health companies, companies called Prisneus. My past lives have been in healthcare, working at large academic medical centers to smaller community physician sites. And I have lived every single pain point you can imagine. Really excited to be here to talk about story. And, I really, when we're talking about change management and story, I want to focus on something a little different and take this in maybe a little bit of a different direction. And, so often we talk about the stories that we tell, we talk about the stories that we hear, but very few, we don't talk as much about the stories that we're actually making in real time with one another. So to put this in context, so in my master's education, I studied story in the clinical setting, and there was a phenomenal medical anthropologist by the name of Cheryl Mattingly who studied this concept called therapeutic implotment. So she was really focusing how clinicians and patients were able to co-construct meaning in the face of uncertainty and illness and transformation. And when you're thinking about this in terms of change management in healthcare, this framework can be an incredibly powerful tool for navigating resistance, for fostering engagement with your people, for ensuring that technological innovations like AI are really integrated in a way that clinicians and patients can really connect with. So just to frame this a little bit more specifically, so therapeutic implantment. So what you're doing is you're weaving a fragmented, uncertain, chaotic experience, which is healthcare, right, into a meaningful story. And it takes the shape of healing and change and progress as this great narrative journey. So think about this. We right now, in this moment, are creating a story. Right now, this very second, we're creating a story. Like, how does that make you feel? Does it give you a sense of agency? It makes you feel empowered. I mean, we don't think of our lives this way. What Mattingly is talking about is so profound. And it gives us this sense that we are change agents in this process, right? So we really come to know ourselves and other people and processes and workflows through story, through narrative. So it's really a matter of creating that lived experience of transformation where clinicians and patients and industry can really shape this unfolding story together, right? So what are maybe some key components that we need to think about as we're talking about real-time story making? So I think one area that we need to talk about is the framing, right? So one of the reasons why change often feels so disruptive is because it really challenges those established narratives of professional identity, right? You've got characters that are all coming to a situation or an issue coming from a different place. There's a solution that needs to get implemented, and you're each coming, you have your own identity, you have your own perception of the world. So being able to take a step back and reframe that story in real time is incredibly important. And it comes back to the language that we use to help people understand and reach common ground. So that's one way. One of the other areas that Mattingly really emphasizes is this co-creating change, this co-authorship, right? So therapeutic implantment, it's not like a passive process, it's interactive. You know, change management often fails so frequently because clinicians feel acted upon rather than agents of their own story. And that sense of agency, you're going to hear me talk about that a lot in the context of change management and AI adoption, that sense of agency is so important because people want to feel empowered. They don't want to be passive participants in the process, right? So really getting that co-authorship, getting people involved. Again, I talk a lot in the space about the importance of it in an interdisciplinary approach, making sure that you're including all parties, incredibly important. So the other part of this is, moving on, acknowledging in the context of story making is acknowledging struggle as part of the story. Every story has a series of characters, right? And there's something at stake, right? Every good story has something at stake. There's a wanting, there's a desire. There's a move from, where we are now and where we want to be. And the same applies in healthcare, right? And we can use these different kinds of ideas, these narrative ideas, when it comes to creating meaningful change in the healthcare context. So really, implantment, you're not ignoring the uncertainty, you're not ignoring the doubt, you're not ignoring the resistance, you're really kind of weaving the struggle into like a larger narrative context. So this includes the interplay between you and other people, right? Other people and other people, making sure that that interplay is in motion, right? We don't want to stop communication abruptly. We need to work through our issues, make sure that we're on common ground. Obviously going back to every person has a different idea of how things go. We need to make sure that we're keeping our eye on what the goal is, what the outcome is, making sure that our patients are kept at the forefront, right? The patients are at the center. So that's really important to acknowledge that and work with struggle. And my last 2 points, focusing on those therapeutic moments to reinforce change, right? We want to celebrate the wins and we don't talk about the wins enough, right? Like there are things that work, even if a decision is made, that's a celebratory moment. And that's really important because it helps really ground the relationship, solidify the relationships you have with other people. Struggle is going to be part of the story no matter what in AI adoption. We understand that. But it's a matter of also taking a moment of pause to celebrate the wins and the things that are working and the relationships that are being cultivated during that process. Incredibly important. And then lastly, using retrospective sense making to really cement that change. One of Mattingly's insights, she talks about how people often make sense of events after they occurred. It's like in hindsight, like we all talk about something and then it's not until after when you're in the shower, you're like, oh wait, like I get it, like I know something, or I call them hallway talks. You get some of your best ideas in the hallway when you're caught off guard, right? You're letting those ideas marinate for a little bit. But that can really help in the transformation process, giving people time, a moment of reflection, coming back to them at later moments in time. And it really kind of fosters more of that interdisciplinary approach that the relationship building is part of that. So those are really some kind of key concepts that relate to the story making that I think we need to be very cognizant about when we're deploying AI tools, because it can be an incredibly powerful way to overcome any kind of issues with change.
I've got so many more questions. I have so many more questions, actually. And we are out of time. So to people, what I'm going to do is I'm going to try and rope some of these speakers into producing some bonus clips. If they say yes, they may not all say yes. We're going to have some follow-up because I actually there's so many things I wanted to expand upon, but we're out of time. I'm going to bring everybody on the screen. And let's see. Yes, Chewbacca. And Obi-Wan's a glowing blue Force ghost. We don't have a zoom filter for that, but just imagine. You have to use your imagination. Jedi Council's present. Lando sold us out to Darth Vader, but we've forgiven him. He had a pressing reason. Thank you very much for everybody. And I think final word. Can you do a quick final word, Ekanjali?
Yeah. I mean, I would love to summarize all the rich content we've heard today, but in the interest of time, I'll keep it short today. I guess we think about AI as data, algorithms, and the juxtaposition of actually the human narratives that those are embedded within. I think, Kofi, you said it best when you said, it's the way that it's embedded. Oh, I forget the line. Technology is in the service of the human experience. And I think that's a really good summary of what we've heard from different lenses from all of our speakers. So thank you all. And till next time.
Yeah.
Brian B.
Oh, yes. Thanks. So I work with health technology leaders and really only on two things, helping them to be clear and memorable about their IP, whether that's a product or software as a service or appliances, anything like that. Clear and memorable. That's my area.
His LinkedIn profile is on the event page. Obi-Wan. We meet again. Kate.
Don't forget where you come from and your core beliefs. Imagine it's your mum on the receiving end of your solution and talk to Granny, connect to Granny, build a relationship with her, and things will transform for you. If you'd like to book a clarity call, I'll put my link in the chat.
Amy Zolotow.
Go out there and make your story. Go out there and make your story. That's all I've got.
Impressive. Most impressive. But you're not a Jedi yet. Brian Litten.
Do your research and never stop honing and building your narrative.
Lando Calrissian. We won the Millennium Falcon fair and square, by the way. We don't want to hear any more back talk about that.
Yes, my last word is meet people where they are, and use your solution to take them to where they want to be. And with that, you need a roadmap. And I'll drop in. I have a brand authority score to kind of see where you are in the from recognition perspective, how people understand your brand. I'll drop the link in there, and it's a free asset that anyone can use and see where your brand is right now.
I'm Jose Garcia. I produce webinars and video to build community in health AI and help people engage. And I want to thank everybody for coming. Thank the speakers. Ekanjali, do you want to end the event?
I guess I just want to thank you, Jose, for this wonderful setup of a meta narrative, which I've personally enjoyed, and certainly will be binge watching all the Star Wars movies after this. Suggestion for the future: maybe we could try Lord of the Rings, Harry Potter, or am I revealing too much now about myself?
Does that make me? I guess that would make you Sam, Ekanjali, or Frodo. I'm not too sure. Maybe I'd be Sam.
I'm going to go with Galadriel, actually. Yeah.
All right. Take care, everybody. Thank you so much for coming.
Thank you.
Thank you.
Bye.
Bye.
Bye.